Words are action, and action is a form of words. This adage by Ralph Waldo Emerson is fitting for our objective, which has been, since the start of the entire process with ADBCAP, to help Scott Merrill and others develop the kind of messages necessary to inspire positive biosecurity actions.
And I'm just going to give you a little context of what you're going to see here today. What you're going to see is a culmination of much research that we've done. First of all, in terms of developing a model that we have called the IDEA model, that's theoretically grounded in multiple theories that have come together to inform it, including experiential learning, social learning, exemplification, convergence, and now communities of practice. And we've done message testing on this model in both using quantitative and qualitative methodologies across risk and crisis types, ranging from natural disasters to pandemics, and most recently on the PEDv situation, and also among diverse audiences, cultural and co-cultural groups within the United States and around the globe. And so what you're going to see today is and then for the past 3 years, we've been doing research using the IDEA model specifically on the case of PEDv. What you'll see right now is an extended example of video clip excerpts of a training module that could be used to teach people what needs to go into this kind of a biosecurity action-producing message. Yeah?
In the spring of 2013, a deadly virus began invading American hog farms.
The pigs looked perfect, nursing on the sow, just born. Within 12 hours, they were all dead.
The virus was porcine epidemic diarrhea virus, also known as PEDv, a known virus in Asia but unknown to the U.S. By March of 2014, the diarrhea virus had reached Kansas, spreading from one state to 33 states in less than 12 months. And most alarming, even farms with high levels of biosecurity like this one were becoming infected. And across America, hog farmers were losing 100,000 baby hogs each week.
So one thing that you'll notice that was happening at that video is up in the upper right-hand corner, the IDEA model elements, I, D, E, A, show when that's the primary piece of the message that's being exemplified in the video. So we're going to see snippets throughout now in that way.
All part of a training video that we're developing that will be available to wide audiences at no cost.
Correct. So our goal has been over the years is to try to create a model for designing effective instructional risk and crisis communication messages that's based on rigorous, theoretically grounded research. It's easy to use because everybody's not a risk communication specialist, that it empowers people to make informed decisions, results in appropriate self-protective actions, mitigates harm, and potentially saves lives in some situations. So the IDEA model is an acronym, which is a heuristic to help people remember what elements need to go into this message for risk or crisis communication. Internalization, distribution, explanation, action. So that's a short heuristic to remember the content that needs to go into these messages. Internalization has to do with getting listeners or receivers motivated to attend to and remember and respond to the messages, right? So it's am I or those I care about affected and how? Distribution has to do with which channels will best reach target populations. Different people seek their information through different channels, so we need to think about which people we're trying to reach and use the channels that they're likely to be seeking information from. Explanation, what is happening and why. And action, and that's really specific deliverable action steps about what you should do or sometimes what you should not do for safety and well-being of you or those you might care about, right? We did a lot of study originally, and what we have found out is that typically the messages that come out when we have a risk situation or a crisis situation focus on explanation. We've done multiple studies, and the status quo kinds of messages that we see tend to privilege explanation over internalization or action. More information, more information, more information. And people sometimes think information equals instruction, but it doesn't. We need internalization and action if we're going to enact behavioral change. So internalization, what kind of things can go into internalization to motivate people to attend to and remember and react positively to a message? One is compassion, and that's a really interesting piece, compassion. We like to use the quotation that John Maxwell, who's a communication leadership specialist, often says, is he says, people don't care how much you know until they know how much you care. And that will motivate people. If they know you care, then they're willing to give you the time of day. And I like to put this little picture up there. That's me. We've been doing some research in Uganda in the Bududa district where they have really massive mudslides, and the mudslides kill many people. And we're working with that group of farmers that live in those mountain areas about how we can help save lives, basically. And well, the first time we trudged up the hour-and-a-half trek up the mountains to get to the village, they were kind of hesitant about whether or not to talk with us, right? We wanted them to share their stories. And I knew that we were making progress when one of the farmers came up to me with his little goat, and he handed it to me so that I could hold his goat. So another way we can get listeners to be motivated to attend to and listen to the messages through stories, through narrative. And we'll talk a little bit about narrative, or Tim will tomorrow about that. Personal impact. What is the impact of this situation if you do something or you don't do something, right? And proximity, how close is it to you? Is it going to affect you? The stuff that Gabriella talked about with the simulation that really shows how proximity, how it can spread so quickly. Timeliness, how much time do I have? One of the difficult things is if we aren't going to see the effects for a long time, it's harder to get people to motivate it and attend to it. If they know that it's now, it's immediate, it's easier to get them to attend to it. Certainly when you think about climate change, we have some issues with that we have to deal with. And also exemplars. And exemplars are heuristics, little cognitive shortcuts to help people remember. And they can be positive, like that cute little piggy there, right? Or they can be negative, like that pile of dead piggies over there, yeah? And Dr. Getchell did some work with some focus groups and a message study where one group of people saw the message without any negative exemplars and the other with many negative exemplars in PEDv. And the people that saw the negative exemplar messages were like, whoa, that's what they remembered. It helped them trigger their memory, so it worked. So I will show you a little clip of the video that has internalization as featured.
Our story began on March 24th, I believe it was. It was a Sunday afternoon. I was here just checking on the ventilation because it was a little bit warm that day. I went into one farrowing room and saw a litter that was scouring or had diarrhea, and I thought, well, crud. So I, treated those pigs, went home, came back the next morning, 6:30 the next morning. We had over 100 litters scouring or with diarrhea.
It was a ghastly disease, and while adult hogs could recover, the baby hogs had almost no chance. Dr. Steve Dreetz at Kansas State joined the race to find answers and new tactics for farmers.
This is a virus, so antibiotics are not going to be effective. One of the researchers calculated that a thimbleful of this virus could infect every pig in the U.S.
It was a disease, an outbreak that was now a runaway train of death for the farms that breed the country's supply of pork.
They were just covered in diarrhea, and they were laying on the sows trying to warm themselves because their core body temperatures were decreasing. And you would have perfectly healthy pigs born, nursing a sow, and 12 hours later they were all dead.
Okay. Moving on to distribution, we're talking about how that message is shared. We've already spoken with the group off and on about repeated measures, how many times that message is heard. But what we want to see here on the next slide is we can look at convergence of multiple agencies. One of the things that happened in extremely effective manner with the pork industry is that the National Pork Board, National Pork Producers Council, American Swine Veterans, you can see the group came together and worked collaboratively, which inspired us to work with Dr. Iverson, who's here too, and we'll talk tomorrow, the next slide, on developing a community of practice and understanding the function that a group like this has to produce, involving mutual engagement or collaborating for shared repertoires, developing best practices together, and making decisions together that the group can follow as a whole. One of the things that we look for in these communities of practice, again, is that people can work effectively across organizations and that they can generate a shared knowledge that they're doing this together, research together, sharing this, and then building these collaborative problem-solving skills. Unique to this case, but we believe that it can be transported. I mention this because we'll come back to this at the very close of our brief presentation.
And so what we found when we did interviews with swine experts for the PEDv case is we found that indeed mutual engagement and shared repertoires were happening. We did some studies and we found out that there was one of the big reasons that they were so effective is that they did conduct this collaboration that was more than just working with networks, but it was bigger than that. They had weekly conference calls. They distributed via pre-existing channels regularly. And we also discovered that there was convergence. There was joint decision making. They had a diverse network already in place. They trusted each other. They added they had multiple diverse experts in the room. They had meaningful action steps. They all agreed on those decisions, and they had rehearsals and modeling for enacting that behavior. Mm-hmm. So explanation, E, is about source credibility. We've already talked, people have talked about the importance of having to have different sources. Different people rely on different sources for their information. And in fact, what we've studied, discovered in some of our research is that when people hear about something in the news, they seek confirmation from 3 to 5 sources before they'll decide that I got that right, hey? Okay. Accurate information, it needs to be accurate. And one of the things that's really critical is intelligible translation. Sometimes scientists, all of us, have our own jargon, our own language, and we have to translate it intelligibly to non-scientific publics. So here's explanation.
But more important steps were needed. Farmers needed to isolate themselves from the chain of infection. Dr. David Newman was on the front lines in North Dakota as the disease jumped from farm to farm and state to state.
PEDv was a whole new beast to this game, and we lost 9 million young baby pigs in a very short period of time. And that's a tough lesson for us to learn.
But the lesson was to create new hard lines of separation between the outside world and the inside of a farrowing barn.
We learned then that being vigilant all the time was critical, not just at a time of being challenged with animal health, but really getting in there and understanding where your feed supply comes from, who's hauling your pigs, where are the trucks going? Where are the humans going that work for you?
As Newman suggests, farmers were recognizing they need a wider view of biosecurity steps.
And the final step is action, and that's those specific actions. Be specific about what to do, when to do it, how to do it, in preparation to avoid harm in a risk situation or in response to a crisis event.
Newman knows the issue well. He's not only a veterinarian and animal science professor, he is also a hog farmer and is vice president of the National Pork Board. He helped write the new rules.
We're going to try to create an instant break line of separation on biosecurity. So we require all personnel entering that barn to come all in to the facility with a shower in, shower out facility.
Which means, as we see in this demonstration video, all outside clothing and material remains outside, and workers redress in farm-supplied clothing on the inside.
Trucks are a huge issue. We need trucks to get feed on and off the farms to feed mills. We need trucks to get the pigs transported from facility to facility. So cleaning trucks is extremely crucial, and we learned a lot in PEDv about cleaning trucks.
In addition to cleaning trucks, new guidelines call for disinfecting the birthing areas. And feed is now more carefully monitored. No issue has become too small for hog producers to ignore in the face of old or new disease threats.
Good biosecurity protocols will prevent any, disease threat or any unknown disease threat that you have. So that's the benefit of the return on investment for biosecurity is they're non-specific. It helps you deal with the unknowns.
And the unknowns may be around the corner, or at least around the world. A new disease, African swine fever, is a threat and a story for another day. A story we can't risk repeating.
It's nothing I'll ever forget, and anybody that went through it will never forget it.
Not forgetting and keeping up a biosecure line of defense may be the only thing hog farmers can count on to keep them safe. For the news, I'm Ron Blome in Central Kansas.
African swine fever is not really a story for another day, it's a story for today. As you know, this is a major challenge that the industry is facing, and it fits the parameters of our grant. That's what we're working on right now. Our goal is to transport the lessons learned from PEDv to African swine fever, more specifically to understand the degree to which the industry is capable of making that transportation of ideas. So just to, as you know, many of you already understand the disease. It's extremely deadly, and it's spreading rapidly in Asia, Africa, Europe. You can see that this is just a recent map. We were just in Germany talking about this model and talking about AFS, and this is from the Klaus Derner at the Institute of Animal Health in Germany is characterizing to his industry leaders the disease, African swine fever, as human-driven disease. As a human, then, you can help protect or prevent this disease. So that's the kind of message that we're taking forward. And as I return to communities of practice in the last slide, we're looking at how can we help the industry or measure the extent to which the industry is able to preserve those networks that Deanna described, putting together the groups of people that had to share information and translate it. How can we have the kind of mutual engagement in a rapid research planning for this process? And then a shared repertoire again. How can we adapt the actions that were appropriate for PEDv to African swine fever? And the hope is that our goal would be then to help develop the words that can help inspire the kind of transportation of these ideas, and then turn those words into the kind of actions that we've talked about today in reducing risk.